Welcome back to Orlando. We're now in step 2. Step 1, we implemented a comfort management program, topical, or Toradol first. And if you're going to do quantum under the skin or insert a suture, probably cafazolin or clindamycin, depending if they're pan-allergic or not, 1 dose, nothing post. And so Toradol, topical, 23,7 in phenylephrine, lido, tetra, phenylephrine. And then I deployed blocks, mesotherapy, lidocaine. Now we do the RF, inside out quantum, pop, 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 which is fractionated, or outside in Morpheus, or both. And so our patient is nice and comfortable. Because we're going to be inserting the device under the skin, both RF and ultimately a suture, we need a sterile technique and a clean environment. So just like yesterday when we did the tummy, I have a pair of gloves. Usually your little minor surgery pack includes a half sheet or 3/4 sheet, and that's a bit of overkill, but if you have it, use it. Excellent. And we're going to use a little square drape, blue towel, which is disposable. We'll do a little square drape around the base of the neck, just to keep the tip of our device, our quantum, completely sterile and comfortable. She's comfortable from our local, and we're going to keep it sterile and prevent contamination. And so once you've got the patient set up as if you're doing a lipoma or a mole excision, and you've done your local anesthesia, chin up, young lady, the next thing is going to be deploying little sterile technique. So we're going to use chlorhexidine. As I said yesterday, I like the clear chlorhexidine, not betadine, not the pink chlorhexidine, which leaves the skin kind of pink. And patient reads in your post instructions, watch out for cellulitis. They think it's cellulitis. So we're going to sterilize the area that I'm going to insert my quantum. Later, when we insert our suture to support, we'll sterilize that area. If you're doing Morpheus, not a bad idea to clean the skin. You don't want to drive makeup and bacteria into the skin with any technique. So always cleanse the skin. Make sure, of course, all the makeup is taken off. Excellent. So a little sterile prep. Once we've done the sterile prep, we now need to pick our device. We're going to go inside out first. So I'm going to use our Quantum RF10, just like yesterday. Very ergonomic, easy to hang on to, quite small, 10 centimeters long, 2 millimeters in diameter, positive proximal, negative distal tip, all the bipolars happening at the tip. You control it, you know where it is. You do a pinch and distraction test, and in between, if you can zoom in even more, George, is that little ceramic interface that separates the proximal positive electrode from the negative rounded distal electrode. Positive to negative. Okay? I'm going to hand this off now to our young lady. And George, come over to our machine. Let's take a look at our machine. And perfect. So here's the Ignite now. We saw it yesterday. We're plugging in our minimally invasive. It will now light up. Our Morpheus is already connected and lit up. And we've connected the black hand piece, which will be our M24. So I'm going to show you quantum and then M24. I'm going to use the M24 in its reductive, lifting, and tightening settings and parameters. And we're going to use the Ignite Quantum 10 in its shrinking and tightening capability. So we hit the button. Okay. And we're going to, again, let's take it out, turn the whole machine off, and let's try attaching that again. There's a male-female interaction that needs to happen almost seamlessly, and we're showing you every possible difficulty that we can show you on setting this up. And so let's pretend we didn't even see that, and let's do it all again. So we're going to turn on our machine. It'll load the software, and then, help me that. There's a little male-female connectivity. Most companies make it extremely difficult to simply connect a product, and the male-female connection with InMode is no exception. So 1, 2, 3, 4, top secret code, open up our software. Now we're going to make it look seamless. We insert and we twist, and then it lights up. There we go, and anytime it flickers like that, doesn't bode well. Here, Let me try that. And so we're going to do a little insertion of the handpiece. And basically, once you connect the male to the female, it should light up beautifully. This one is not. So normally the connectivity is quite simple. We are making this look much harder than it needs to be. When you push in, it should connect. So I'm just going to take a look at the little pins. Sometimes one is bent. You have another 10? Perfect. I'll hand that off to you. Let's not make this contaminated just yet in case we have to pull it out. Now, if this happens in your office, and sometimes it happens, you simply wrap it up, ship it back to InMode, and they would 100% of the time give you another one because they will know based on the IR card, each one has an IR card, whether it was ever fired or not. If it wasn't fired, you get another complimentary applicator, which means you want to keep 3 or 4 of these in inventory to make sure you always have an inventory in case for whatever reason it doesn't fire off the line. And so wrap that up, send it back and say, didn't fire. Now, if you're trying to pull a fast one, they can check out the IR card. There's an IR reader in each one of these, and they know if it was fired or not.